two other words that I think really are important for my experience of working with patients here. And one is dignity, and maybe that comes into how we interact with their complex lives, the chaos that they bring with them, and a lot of people, maybe in other medical practices or maybe just in their lives or on the street or dealing with corrections or whatever, treat that chaos as almost dirty, as subhuman maybe. Maybe there are people who live on the streets and they have people walk past them all the time and give them sort of, down their nose kind of looks. So by treating them as people, as humans who are made by God, we feel that they get given a level of dignity here that is a real positive thing for them. And the other thing that sort of flows from that is agency, and that's a real important thing that I've been thinking about a lot lately, that when people don't think they have any value, they get to the point where they just roll with life. They just let it wash over them, this way, that way. Their health of being a classic issue, so they don't attend to the things that need to be attended to. But if you suddenly put people in control or give them some control over their lives, then it changes the way they look at their lives. And so they start to engage with their health, which is, one of the key things we're trying to get people to do here. They might engage with their mental well-being, they might engage with their social circumstances, because they know that there are things that they can change. Smoking cessation would be a good example of that. If people have just assumed that they can never quit, then they will never try to quit. Whereas when you work with them and say, well, actually, it takes so many times, but people do succeed, and you treat them like a person and say, well, I believe you can quit. This can be as simple as that sometimes, to start people on that path towards changing.